Hey everyone, Matt here. So we're just waiting now for the White House press briefing. This has been happening every day lately. They come out and they brief us on the latest information that we know for the day, and then reporters are typically in the room, and they usually ask a bunch of questions regarding stimulus, including the stimulus package and stimulus checks. So hopefully we'll get some of that Q&A today and see what they have to say. Like I always say in my videos, we want to listen to this stuff because you never know what kind of insights you're going to get when they actually have these Q&A sessions. Typically things, kind of come out a little bit and you get a little bit more glimpse into what they're thinking. So that press briefing should be starting here any minute. And as soon as it does, we'll jump in there, we'll listen to it and see what they have to say. All right, here we go. Let's do it.
Time for questions today. I wanted to share just a few updates with you. First today, President Biden signed 2 executive actions that will begin to restore and strengthen Americans' access to quality, affordable health care. Specifically, he directed agencies to re-examine rules and other policies that limit Americans' access to health care and consider additional actions to strengthen Medicaid and the Affordable Care Act so they can continue to provide access to life-saving care for millions of Americans. As a result, the Department of Health and Human Services will open healthcare.gov for a special enrollment period from February 15th to May 15th. And just as a reminder, the prior administration only had it open for 6 weeks, so this is double that length of time. Starting February 15th, Americans without health insurance can go to healthcare.gov and sign up for health coverage, often at little or no cost. The president also rescinded the global gag rule, which bars international nonprofits that which bars international nonprofits that provide abortion counseling or referrals from receiving U.S. funding. And he directed the Department of Health and Human Services to take immediate action to consider whether to rescind regulations under its Title X family planning program. These also, of course, build on the actions the president has taken to put equity at the heart of his administration's response to COVID-19. Second, I wanted to update you on the amendment being made to the Public Readiness and Emergency Preparedness Act, or PrEP Act, declaration on the COVID-19 response. HHS will amend the current PrEP Act declaration to permit recently retired doctors and nurses to administer COVID-19 vaccines, and to permit anyone currently licensed to vaccinate within their home state and to administer shots across state lines. So we've talked a lot in here about the need for not just vaccines, but vaccinators, and this is an effort to put more vaccinators in the field. A number of states have already taken action to ease licensing requirements to expand the vaccinator workforce, but this nationwide action will make that easier across the board. The amendment will help us in our vaccination efforts with the continued goal of 100 million shots in 100 days. Also today, I just wanted to point you to, which you may have all seen, the statement by National Economic Council Director Brian Deese about the quarterly GDP and weekly unemployment claims. And finally, a note on the Vice President's schedule. Today she's doing local TV interviews and meeting with editorial boards in West Virginia and Arizona to discuss the American Rescue Plan. So with that, go ahead.
Thanks, Jen. I've got 2, one
Q&A.
foreign, one domestic. I wanted to ask you about the Pakistani Supreme Court's decision to release the man that was convicted of the killing of journalist Daniel Pearl. Does the White House have a response, and are there plans to ask for his extradition to the U.S. for a trial?
The United States is outraged by the Pakistani Supreme Court's decision to affirm the acquittals of those responsible for Wall Street Journal reporter Daniel Pearl's kidnapping and brutal murder, which shocked the world's conscience in 2002. This decision to exonerate and release Sheikh and the other suspects is an affront to terrorism victims everywhere, including in Pakistan. We recognize past Pakistani actions to try to hold Mr. Pearl's murderers accountable, and we do note that as of right now, Omar Sheikh remains in detention in Pakistan under national security authorities. But we call on the Pakistani government to expeditiously review its legal options, including allowing the United States to prosecute Sheikh for the brutal murder of an American citizen and journalist. And we're committed to securing justice for Daniel Pearl's family and holding terrorists anywhere accountable for their heinous crimes. And the State Department, I know, also just put out a statement.
I wanted to to ask about this flurry of executive orders we've seen. President Biden ran on a pledge to restore unity. He promised on Inauguration Day he'd be a president for all Americans, but since he's gotten into office, he's been largely acting unilaterally. I mean, we saw a record-breaking number of executive orders. He has not yet met with lawmakers on Capitol Hill, and we're not even quite sure who he's talking to on Capitol Hill. So what do you say to Americans who are watching all of these executive orders? And does the White House think that this is the best way to make policy, considering an opposing president could come back in 4 years from now and erase all the work he's done with the stroke of a pen?
Well, there's a lot to unpack there, so let me try my best. First, the president put forward a large and bold COVID relief package, $1.9 trillion, that is meant to address the challenges the American people are facing and the dual crises that that the country is facing, from the pandemic to an economic recession as a result. That package has the support of the majority of Americans, according to every poll that we have seen publicly released. So I would say first that part of unifying the country is addressing the problems that the American people are facing and working to reach out to Democrats and Republicans to do exactly that. And that's exactly what he's doing. He's had calls with Democratic and Republican members of Congress, many of them. He's doing more calls today, but he's doing calls regularly throughout the week and has done them back to when he was inaugurated and even before then. But he's also calling Democratic and Republican mayors and governors to talk to them about what their needs are on the ground. So his objective as president is to deliver on what he promised in his inaugural address, govern for all of the American people by focusing on addressing the issues that people are facing that aren't just hitting blue states or red states, aren't just hitting Democrats or Republicans, but are crises that we are all facing. And I think the polls will tell you that people are responding to that. In terms of executive actions, he also ran with a commitment to take steps immediately to address the pain and suffering that the American people were feeling. And that includes overturning some of the detrimental, harmful, and at times immoral policies and actions of the prior administration. But he's the first to tell you, as he said many times publicly, he's not going to take executive action alone. That's why he's put forward a number of packages that he's actively working with members of both parties to move forward on.
Wow.
Well, if the issue is that Congress is so broken that he needs to work quickly unilaterally to get some of this done, then does he support the move towards reconciliation that Senate Democrats are talking about right now? It's essentially the same idea.
Well, I didn't say that was his point of view. Those are your words, not mine. I would say his view is actually that these policies, the policies in his COVID relief package, are policies that are not Democratic or Republican. Everybody wants their kids to go back to school. Everybody thinks that there should be more shots in the arms of Americans. Everybody thinks that the American people should get more relief and a bridge in this period of time that is such a challenge. So what he's saying is, here's my proposal. Here's how I think. Here's how economists, medical experts, health experts think we can address these crises we all agree are impacting all of our constituents across the country. Let's have a conversation about it. That's what he's doing. At the same time, he's not going to delay action that would help bring relief to the public and help bring access to affordable health care to the American people, help ensure women have access to reproductive health as well. So, there are a lot of steps he's taken over the past couple of weeks. He's not going to delay actions that require immediate action, that he can bring that relief immediately, but he's also going to work with Congress. He's proposed multiple bills to do that.
Following up on that, Democratic leaders on the Hill appear to already be eyeing reconciliation. We heard Leader Chuck Schumer today saying that they're moving ahead with or without Republicans. Does this undermine your calls for bipartisanship, and are you urging them to give this more time?
Well, we're all very close to this here, reconciliation and all the terminology in Washington. Everybody who's watching may not be. Reconciliation is a parliamentary process. It's a way to get legislation through. It's a way to get relief to the American people. The president wants this to be a bipartisan package, regardless of the mechanisms. Republicans can still vote for a package, even if it goes through with reconciliation. There's no blood oath anybody signs. They're able to support it regardless. And he wants this to be a bipartisan package. He's listening to Democrats and Republicans. We all are, to ensure that that's what it looks like at the end of the day.
But it doesn't seem that you can get both the speed you want and the bipartisanship at the same time. So which is the priority?
I don't think that's true. We refute that notion. These challenges that the American public are facing are urgent. People don't know how to plan to have food on their table now. They're worried about whether their kids can go back to school in a couple months now. They're worried about getting the vaccine now. And those are issues that Republican elected officials are hearing, Democratic elected officials are hearing from their constituents, and we're confident that people are going to listen to them and come together to support a bipartisan bill.
And just one other question on COVID. The South Africa variant is now been discovered to be here in the U.S. You, of course, have taken steps to ban non-U.S. citizens from South Africa from traveling here. That ban goes into effect on Saturday. Can you explain why Saturday? Why not sooner?
Well, the testing requirements we put in place that you noted were put in place for all departures, including South Africa. They take place. They will be put into effect at noon on January 26th. So this actually goes into effect Friday night.
So just a quick second while they're talking about this variant. This is why we want to listen to the Q&A, because typically a lot of times they ask questions that are completely unrelated to why they're having the press conference in the first place. You notice they were supposed to be coming out talking about healthcare. They talked about that for a couple minutes in the beginning, and now we have all the questions regarding the stimulus package, and they're talking about reconciliation. We've been talking about that a lot lately in the videos. Yeah, they're talking about it again.
Sign a bill that only Democrats voted for? Well, we're not quite there. That's getting us a few steps ahead of where we are now. He continues to believe that this should be, and will be a bipartisan bill that receives support from Democrats and Republicans. And he's having conversations with and listening to leaders and members of both parties to assure that we get to exactly that place.
But if we got to that place where only Democrats had voted for it, is he okay with
We'll
that?
have a conversation at that point. We're not there yet.
Okay, so second question on, given all the volatility surrounding Wall Street and GameStop, what is the Biden administration doing to protect the average American investor if there is going to be potentially a major market correction coming?
Well, the SEC put out a statement. I believe it was today, or in the last 24 hours, I should say. We refer you to that. We're not going to have additional comment from here.
Beyond just monitoring it, has he had any...
All right, so they're just talking about the market here for a second. But yeah, this is why we listen to it, because you never know. All these reporters ask questions regarding the stimulus and everything else. So, like we've been talking about in the videos lately, they are considering budget reconciliation, which would be able to get that package through very quickly. Well, quickly relative to bipartisan support, because remember, if they're trying to get bipartisan support with this thing, there's going to be a lot of negotiating back and forth on the stimulus package, adding, subtracting, all of that. Well, if they just do budget reconciliation, it's going to be a matter of just wham, bam, thank you, ma'am, and they hit the road, right? They get that thing passed. So, if they're looking for speed, that's what they might be doing. All right, let's listen for a second again.
The urgency of getting his team in place to address the range of issues we're facing.
Okay, they're still talking about...
For Mr. Gensler.
Go ahead, Brianna. Thank you so much.
Hang on a sec here.
First on the COVID relief package.
Oh, they're talking about it again.
Cut a deal. Would President Biden be willing to entertain a smaller package?
Smaller package.
First,
Now she's talking about asking.
Since there was some reporting this morning, I just want to take the opportunity to be crystal clear. We're not looking to split the package. That is not a proposal from the White House. I talked to the president about it this morning. That is not what our focus is or our intention is.
They want the full 1.9.
And the reason is because we're not going to put ourselves in a place, or anyone in a place, where we're choosing between helping families to put food on the table and making sure kids get back to school, or making sure kids get back to school and getting a vaccine in the arms of Americans. Now, at the same time, what the president has conveyed to all of us and had during his conversations with members of Congress is that he's put his proposal out there. He was in the Senate for 36 years. He, of all people, appreciates the back and forth, the engagement, the opportunity to hear from members of all sides on what they like, what they don't like, things they think should be smaller. Some have proposed things should be bigger. There's, of course, lots of ideas. No member of Congress is a wallflower that are out there in public, and certainly that reflects the private conversations as well. And, there are areas... For example, there has been some discussion of, can this be more targeted? The president believes that, and that based on his recommendations of economists and his health and economic experts. This is a plan. This is a overall package and proposal that is absolutely targeted toward the people who need it most, but he's happy to have a conversation about that, and happy to have a conversation about any component that people are coming at him with good ideas. But our focus is on making it better, improving the package as people have good ideas. We're open for business and open to hear from members of Congress on that, but we're not going to do this in a piecemeal way or break apart a big package that's meant to address the crisis we're facing.
On COVID, can you confirm that the Biden administration is actively looking into expanding mandatory testing for domestic travelers here in the United States?
All right, so they're talking about travel and the virus and stuff like that. So yeah, like she just said it. Basically, they are not willing to break up the $1.9 trillion stimulus package. They want to push this thing through as a comprehensive package. It's actually kind of funny because I've been talking about all of this in my videos over the last few days here. We've been talking, they don't want to split it up. They don't want any of these piecemeal or standalone bills. They want a comprehensive package. They're potentially willing to negotiate on it a little bit, some of the aspects, provided they're getting bipartisan support. But if they just do the budget reconciliation process, they won't really need to, because it's basically only going to have Democratic support at that point. Republicans have come out, and they've made it very clear, hey, we're in support of additional relief, but we need to focus on the price tag of this thing, and we need to make it a little bit more targeted for the people who need it the most. So if you checked out my video from this morning, I talked about who's going to receive the next $1,400 stimulus check. Well, there was some pretty interesting statistics within that video. If you haven't seen it, check it out. Let's hear what they have to say for a little bit longer here. Typically, these things don't last all that long, but we'll see.
48 hours ago about increasing the vaccine supply going to states.
Vaccine supply, they're talking about all that stuff. We can listen to it, but really, everybody wants to know about the stimulus package, the stimulus checks, all of that. It's so interesting when you listen to these things because they come out with the intentions of talking about healthcare, and then there you go. The majority of the comments we've heard so far are questions from reporters have been asked about the stimulus package. A lot of questions about that. Everybody wants to know what's going on with it, including us, right? We want to know too. That's why we listen to these things. We want to get some insights into what they're thinking. Let's listen for a sec.
That's why this is such a Herculean task, because it requires so many components.
Sanofi just announced that it has struck a deal with Pfizer to produce...
Okay, still talking about vaccines and stuff. Also, by the way, I'm still working on a new setup here in my studio. So you're probably thinking this is like really rinky-dink and really old school, that you're literally just playing audio while we just watch you sit there and like write notes and stuff. But realistically, I'm getting some things setting up here. I'm going to be adding some more visuals and doing some more live streams, stuff like that. So I'm really excited about it. But for right now, this is just what I'm doing at the moment. So thank you for your continued patience. I really do appreciate it. But I'm excited for my new setups to be in place here and what I have going for you. So it's all in the best interest of all of you. I'm trying to refine my process so that I can be of best help in any way that I possibly can here on the channel, maintaining my commitment and continuing to expand and doing what I can to reach more people and to better serve all of you that are already here. So, that's my commitment here. Let's listen for another sec here. They're talking about healthcare.
We don't have a number to predict for you, but the reason that the president signed the executive order today was because it felt essential at a time of a pandemic when millions of people are concerned about their health care. Far too many still don't have access, to open up an expanded window for Americans to be able to apply. And we will have a robust public campaign, paid media campaign to reach the American people, and we'll be putting a lot of levers and resources toward that. But I don't have a prediction for you in terms of the numbers.
Absolutely no estimates going in.
We're not going to do predictions from here. Just as many American people who don't have access and currently are not on the exchange that we can reach will be our goal to reach.
And I had a follow-up on the markets and everything that's happening with GameStop.
Okay.
You did mention, I believe, yesterday.
So now they're talking about the market again, which is cool. I'd love to sit and talk about the market for a while, and I can do that in other videos. But also, I want to say something that she mentioned earlier the Affordable Health Care Act, the portal for what was it again? Oh yeah, it's the healthcare.gov, healthcare.gov. So if you're looking for insurance, maybe you're looking for a cheaper insurance, something with better coverage or a little bit lower premiums, anything like that, if you're looking for that, that exchange is going to open up once again. Healthcare.gov, healthcare.gov is the website. And she said open enrollment period is February 15th to May 15th. So check that one out if you if you're interested. She said it's going to be open enrollment February 15th through May 15th. That should be opening up. Healthcare.gov. So, and like she said, that is for reduced or potentially even free healthcare for those people who are eligible. So.
Activities in the Parliament Street is a necessary response to foreign intervention, and that any efforts towards independence means war. Does the administration believe...
All right, she's just talking about who knows what. All right, so this thing's probably going to wrap up soon. Realistically, that's probably all the questions we're going to have about healthcare, or not healthcare, but the stimulus package, things like that. So either way, I feel like there were some good takeaways in there. Either way, I like to listen to all these things because you never know what they're going to say and what kind of insights we can get. So either way, I wanted to bring that to you. Just wanted to do what I can to provide more service to you. Thanks again to all of you. Thanks to C-SPAN for letting us use this information for the press conference here from the White House, and hopefully we can get some more information soon. I'm always here for you, everybody. Thank you so much for your support. Make sure to hit that subscribe button down below and check out my video from earlier this morning or any of my other over 800 videos here on the channel if you haven't done so already. Thanks again. I will catch you in the next video. See ya.